Hello, my name is Michael Gillard. Alright, so the syndrome that I chose was anemic syndrome. So anemic syndrome is basically the reduction in the hemoglobin or hematocrit or red blood cell count causing hypoxia throughout the body. So basically it's the body is not as efficient in terms of delivering oxygen to the cells in the body because of your red blood cells are not being efficient in terms of its delivery. So some classifications could be there's a mean corpuscular volume would be one type of classification, and then a different kind of category would be mechanical. So for the mean corpuscular volume would be the microcytic. The red blood cell can be microcytic anemia, in which there's like the red blood cell is smaller. This can be from an iron deficiency, and then there's a normocytic. That is the red blood cell is normal size, but anemia that could be from blood loss. And then for macrocytic anemia is basically where the red blood cell is larger than normal, where that could be caused from a B12 deficiency. And so some etiology here. So some of the causes of anemic syndrome could be from a nutritional deficiency. So that could be from a B12 deficiency, that could be a folate deficiency, that could be an iron deficiency. All these different micronutrients can be used to create an anemia. And so this can also be from a chronic disease, such as kidney disease, where the kidneys are not producing enough erythropoietin to stimulate the bones to produce red blood cells. So that could be another cause of anemia. And there's a bone marrow disease, some kind of bone marrow disorder in which which would be aplastic anemia, which is where the bones are not producing enough red blood cells. And another disorder of the bone would be leukemia. So that's a cancer that could cause some problems there. And then there could be hemolytic conditions such as autoimmune disorder attacking the red blood cells, causing lysis. There can also be a sickle cell anemia, in which the red blood cells are sickled because of the improper production of hemoglobin, causing the red blood cells to be fragile and to lyse in the small capillaries, that can cause anemia. And also the hemoglobin is not as efficient in terms of its oxygen delivery like a normal hemoglobin would be. And there also is acute and chronic bleeding. So that would be, an acute would be if you had your carotid artery cut and blood was coming out. That would be an acute version, or if they had a cut in your arm and it came out. Anyways, and then there could be a chronic version could be an ulcer in your stomach, bleeding into your stomach, you excreting it through your bowels, or it could be heavy menstruation. That could be another cause of anemia right there. Lots of blood loss through that. Anyways, moving on there. What syndrome is this? So this is a hemolytic disorder. So basically a disorder of the blood, oxygen delivery. Anyway, some clinical manifestations. So some symptoms of that would be some weakness, some fatigue, and some dizziness. Those would be some symptoms. And then some signs would be some cold extremities, would be pallor, and would be tachycardia. So these would be some signs in anemia. And then some diagnostic tests. So that would be some complete blood count. So that would measure all the different red blood cells and the counts. So you would expect to see a decreased hematocrit for that. You would also see a decreased hemoglobin for that, and then you might see a high or a low mean corpuscular volume. That could be an indicator of anemia. And then the differential diagnosis. So let's say you have vitamin B12 deficiency, which could cause sort of neurological problems, and cause some ataxia, and that would also have a low B12 amount there. Versus the differential diagnosis would be for a folate deficiency. In the blood you'd have a decreased folate. But you wouldn't necessarily have, the kind of neurological symptoms that you would with a B12 deficiency. But My name is Michael Gillard, picking up from the last video. Alright, so picking it from there, from the B12 and the folate differentiation right there. So, like I said, for the B12 deficiency, you're going to have low B12 with a little bit of different neurological problems from a folate deficiency. So the B12 would have a little bit of ataxia compared to the folate. But there would be two different kinds of anemia right there based off of the differences in how you would diagnose them. Moving on from there, some possible complications of anemic syndrome would be some severe hypoxia. So throughout your body, you would have complications with that. It would be decreased oxygen to the rest of your body, causing problems with your cells. It'd be harder for your cells to do basic metabolic tasks they would normally be able to with the presence of oxygen there. Moving on would be heart failure. So with the decrease in oxygen, it would cause a strain on the heart. From the tachycardia, would cause it to pump harder because it's trying to get the blood to the rest of the body to provide more oxygen, while the heart is also having less oxygen itself. So this could cause, later on, it could cause a heart attack because of the strain that you're putting on the heart when it doesn't need to go through all that strain. Also would have some neurological complications, could cause some, specifically in a B12 deficiency, you could have some possible neuropathy, peripheral neuropathy. It can cause other neurological changes, like, a little bit of confusion if it was, could get severe enough to where it could be some confusion because of their neurological challenges of not having enough oxygen. And moving on from there, you'd have immune system complications. So with the decrease in oxygen, it makes it more difficult for the immune system to use oxygen for basic immune function like it normally would. But it would also, inhibit the amount of neutrophil production. So yeah, that's all of that. That's anemic syndrome.